Hello everyone, good day. It is Princess Cassandra Pimentel, a nursing student of National University, Merito. And for today's video, I am going to demonstrate the proper ways on how to administer a drug through intradermal injection. So first, let's talk a little bit and I'll show you how to do it. And the first thing you need to know is where is it done. So it is commonly done on your forearm, 4 fingers below your AC. So 1, 2, 3, 4, and it is right here, the most common injection site for intradermal injection. And when it comes to the amount we gave, it is usually ranging from 0.01 to 0.1 ml. For the needle gauge, it is 25 to 27. And for the length of the needle, it could be anywhere from 3/8 to half an inch needle long. So these are little amounts we're giving and little needles we're using. And the syringe we use is usually called a tuberculin syringe. And lastly, we give it in an angle between 10 degrees to 15 degrees. Then, check the provider's order, the healthcare provider's order through the MAR. So, MAR means Medication Administration Record. So, check this twice. So, also keep in mind the 5R, which are the right patient, right time, right dose, right drug, and the right route. After that, prepare the needed materials and the equipment. So, we'll be needing an ampule or a vial containing the right medication, a sterile syringe, a tuberculin syringe, and a needle like this, a cotton swab saturated with antiseptic solution, alcohol for sanitation, and lastly is a pair of gloves. So before the administration starts, make sure to perform hand hygiene first, the proper hand hygiene first. So this practice will reduce the transmission of the germs and prevent the healthcare associated infection. And that's it. After performing hand hygiene, wear the hand gloves and proceed to the preparation of the medication. And after you wear your hand gloves, the next thing you'll do is prepare the medication, then check the expiration date of the medication, the lot number, and the manufacture date. After that, prepare the vial by cleaning the exposed top of the vial. So using a cotton balls, and alcohol. Create a friction by slightly rubbing the top of the vial for at least 30 seconds. Just scrub it, and after that let it dry. So while waiting for it to dry, prepare the syringe. So we're going to use a tuberculin syringe. So it is 1 cc or 1 ml syringe. In here, we're going to instill an air inside the syringe. So we're going to inject the same amount of air that is equal to the amount of the medication we're going to remove from the vial. So this practice will prevent a vacuum from forming inside the vials. So recap the syringe, and assuming that the prescribed medication is 0.3 ml, so we're going to instill a 0.3 ml of air inside the syringe and inject it inside the vial. So using your non-dominant hand, hold the So using your non-dominant hand, hold the vial, and your dominant hand holding the syringe. Inject the 0.3 ml of air inside the vial and flip it, and remove the 0.3 ml of medication. So do this in an eye level, so to make sure that everything is equal. After that, aspirate the remaining air inside of this vial by slightly tapping. This practice is called aspiration. So make sure to make sure that the remaining medication is at exact 0.3 ml. So here is it. I hope that you can see this. After that, recap the needle using a one-hand technique and remove the needle and replace it with a new one. So here it is. And the used needle is going here in your garbage can. After that, dispose your hand gloves and perform hand hygiene. Afterwards, level the medication with the relevant information needed. So we're going to write here the name of the patient, and we're going to write here the relevant information like the 5R, and that's it. So, after entering the room and providing privacy, introduce yourself to the patient and also verify the patient. So, hi ma'am, good morning. I am Cassandra and I am your nurse for today. May I know your name please? Cherry. Okay. And your birthday? November 16, 2000. Okay. Another option for verifying the patient's identification is by looking at their wristband. So, can you see this? So your Charis Pasqua, born on November 16, 2009. Is that right? Yes. So I am here to administer a drug through intradermal injection. So the injection site is in your forearm, right here. Is that okay with you? Yes. Okay. So last thing, ma'am, may I ask you if you have any allergies or anything to be worried about? No. Okay, if that's so, let me perform hand hygiene first. Put some hand gloves on and let's start. And now we're ready to do the intradermal injection. So make sure to place your patient's arm on its comfortable location or in its comfortable position. So like this. And then locate the injection site. So four fingers below the AC. So 1, 2, 3, 4, and the injection site is right here. So allow me to clean your arm first. And then slowly rub it. Create a friction from inward to outward to prevent the contamination. And rub it for at least 30 seconds. Then allow it to dry. Discard this cotton. After that, after we wait for it to dry, we're going to prepare our tuberculin syringe, which is this. It's a 1 cc or 1 ml syringe. So we're going to uncap this needle and we're ready for injection. So your non-dominant hand hold the patient's arm and for your dominant hand hold the syringe. Then inject the medication slowly. So bevel up and using your non-dominant hand hold the tomato and on your dominant hand hold the syringe. So bevel up and insert the needle 10 degrees to 15 degrees. Then slowly inject the medication. So you'll notice that there is a bleb forming at the top of the needle. I hope that you can see this. After that, slowly withdraw the syringe at the same angle of insertion. Then clean the injection site for the last time using a dry cotton swab and discard. Also, dispose this used syringe at the sharps. And that's it. After that, dispose your hand gloves and perform hand touching. And lastly, record all you have done on the MAR or the medication administration record. Also keep in mind to record as well the 5R, which includes the right patient, right time, right dose, right drug, and right route. That's all.